to pain doctor and he says, look, I've looked at your MRI, I've done your nerve test, you need an injection. And the moment we hear the injection, we are overwhelmed with fear. Fear of needle, fear of paralysis, fear that cortisone will make me big, fear that something can go wrong. People, when they have back pain, they go to a doctor who doesn't know how to do injections, or he doesn't want to do injection, or he's a surgeon and doesn't want to do injections. So instead of sending you to some other doctor, he'll give you Madrol dose pack, which is the steroids in tapering form. Now that steroid is quite big dose, taken orally, causes many side effects. And now you go to the doctor who is going to say, I'm going to do 3 injections and put steroids in you, and then you have neck pain and he does 3 steroid injections there, and then you have a joint pain, he puts 2 or 3 joint injections. So in this way, the total amount of steroids getting into your body is large. Today, I'm going to talk about a very simple thing that you may come across when you go to your pain doctor. Naturally, when somebody goes to pain doctor, that means the other things have already been done. You have already taken some anti-inflammatory medication, you have severe low back pain or neck pain, you have already done some physical modalities, you have done a little bit of rest, your pain is very severe, and even you have taken some pain medication. But still, the pain is significant, it is interfering with your function. You go to pain doctor and he says, look, I have looked at your MRI, I have done your nerve test, you need an injection. And the moment we hear the injection, we are overwhelmed with fear. Fear of needle, fear of paralysis, fear that cortisone will make me big, fear that something can go wrong, and you say, no, doctor, can you suggest me something else? Well, what else you can suggest? At that moment, that fear is not the reason to reject or accept any treatment modality. You have to see why it is being advised and recommended. Now, I'm not going to go into details of all those fears, but definitely I would explain to you, if you are in my office, what epidural space is, how we are going to go there, and what could go wrong. Well, what could go wrong could be 1 in a million, but if it happens to somebody, for him it is 100%. So that's why it has to be explained, and today I'm explaining that. Most important thing is take the fear out, because nowadays the technology helps us to reach those areas where we couldn't reach before these technologies. One source of fear of epidural injection is that women at the time of delivery, they are getting epidural injection to control the labor pain. Now remember that epidural approach is for numbing the perineum, that means between the legs, the area from your genitalia to anus, that is perineum. So that is where you need numbness, and in the lower abdomen. So you have to enter at a higher level, where in front of the needle is spinal cord and a fluid-filled sac. So you can enter into those and cause some excessive pain or dysfunction. While epidural injection, which is done for low back pain, is done in a different approach. So that fear should not be there. So distinguish between the different epidural injections. If you don't distinguish between these different injections approaches, you might be filled with fear, and you might hear the stories of epidural injections, because those epidural injections are done without the help of these technologies. At that time, there is no x-rays. We don't want to expose the pregnant woman and the newborn baby to radiation. So they are done blindly. Even though the expert person can really figure it out how to do it, but still it is done blindly. The other thing is it is done at a higher level. So the first thing is take out of your mind, the epidural injection which is done in the labor time. The second part, in the low back when we enter, there are different approaches. So we have the ability of a fluoroscope, which is also called C-arm. By moving that, we can see in 3 dimensions the needle, where it is in the tissues and where the tip of the needle is. The further safety occurs when we put a contrast, which we can visualize, which we can see it's going in the epidural space. So not just the tip where it is, but also the contrast going in the epidural space. And now we are confident, comfortable, sure that the medicine will go only in that area. So that makes it very safe injection. However, things could happen. So that's why, what are the things that could happen? Of course, infection could happen. Anytime you cross the skin, you can put even one bacteria and the person is immunocompromised. That one bacteria multiplies and cause infection. So that's why when we are doing these injections, anytime we are entering into through the skin, we want to clean it properly with antiseptic solutions. So that is minimized. The second thing, we are using the C-arm fluoroscope so that we can see it. The third, we are putting the contrast. So by doing all these things, the chances of injuring a nerve, spinal cord, getting into the thecal sac, which we call the fluid-filled sac around the spinal and nervous tissue. So all these things are minimized to that level that even though there are hundreds and millions of injections are being done every day, very few people have some side effects. So understand it, because the fear of unknown causes anxiety, and that anxiety leads to worsening of pain. Or any pain you feel during this time, you feel very severe. Also, nowadays, a moderate sedation, that means some medicine is given through IV line, intravenously, through veins, that you either relax or you sleep for a few moments and then you are awake. During that moderate sedation, we are going to monitor everything, your oxygen, your heart rate, your breathing. So all these things are being monitored. So the whole process becomes very safe for injections. However, there is a disclaimer. Naturally, I don't know who is the one who has a prescribed injection for you, whether it was really needed, or who is the one who is going to give you. And I also don't know your status. That's why talk to your healthcare provider about this injection. But as far as what you should listen are these. Now, last but not the least is the fear of getting big. Of course, the steroids nowadays being used everywhere. People, when they have back pain, they go to a doctor who doesn't know how to do injections, or he doesn't want to do injection, or he's a surgeon and doesn't want to do injections. So instead of sending you to some other doctor, he'll give you Madrol dose pack, which is the steroids in tapering form. Now, that steroid is quite big dose, taken orally, causes many side effects. And now you go to the doctor who is going to say, I'm going to do 3 injections and put steroids in you, and then you have neck pain and he does 3 steroid injections there, and then you have a joint pain, they put 2 or 3 joint injections. So in this way, the total amount of steroids getting into your body is large. So very important thing is that your pain care should be coordinated. It's better to have just one pain doctor, not all the doctors. And before going to the surgeon, exhaust your pain management options. Don't rush to the surgeon, because remember, if you are not going to have surgery, she is not interested in you. She's either going to refer you to some other doctor or give you some Madrol dose pack. So it's better you go to the surgeon once you have exhausted, or at least talked about, have looked at the option of injection. Last but not the least is, the injection should never be the end point. That, okay, I'm going to give you injection and your pain will be better and things will be normal. It never happens like that. If somebody is telling you he's claiming non-scientifically. Basically, it is a means to another end. What is the means? We did the injection, we blocked the pain cycle, but now the window of pain-free or less pain is there for us to rehabilitate your low back or the area where you're getting the injection, because the muscles around it still can be modified, can be toned up, can be stretched. So in this way, that 4 to 6 weeks of window of less pain can be used for therapeutic exercises. In case of lumbar spine, low back, we use lumbar stabilization exercises and hip flexibility and stretching exercises for your legs. And also at the same time, learn how to use your spine more wisely. So these are the things we need to know about an epidural injection.